She swallowed her own hunger each morning so he could live, until a stranger in scrubs changed their fate. Eleanor woke before dawn, the familiar ache in her stomach a constant companion these past months. The kitchen clock ticked accusingly in the silence as she shuffled to the refrigerator, its barren shelves a testament to her sacrifice. She pulled out the carton of milk, measuring exactly enough for Tyler's cereal, then tucked it away again. Just a little longer, she told herself, ignoring the tremor in her hands. Just until we have enough. The stack of medical bills on the corner of the table had grown tall enough to cast shadows across her empty plate. Eleanor's weathered fingers traced the red UR-Gent stamps that adorned each envelope like battle wounds. $8,000 still needed for Tyler's heart surgery, and the calendar on the wall showed only 3 weeks until the scheduled date. Her Social Security check wasn't due for another 11 days. She closed her eyes against the rising panic and listened to the soft, labored breathing coming from her grandson's bedroom down the hall. Tyler had been born with a heart defect that his young body had compensated for until last winter, when a simple case of flu had revealed how fragile his existence truly was. His mother, Eleanor's daughter, had disappeared into the grip of addiction years ago, leaving Eleanor as his only guardian, his only hope. She had already sold her wedding ring, her husband's watch, and the television that once occupied the now empty corner of the living room. What remained was this daily calculation, her hunger against his life. The kettle whistled sharply, startling Eleanor from her thoughts. She poured hot water over a tea bag she'd already used twice, watching the pale amber color swirl weakly. The sound of shuffling feet made her straighten her stooped shoulders, pasting a smile onto her face as Tyler appeared in the doorway. At 8 years old, he was too thin, too pale, with a bluish tinge to his lips that tightened Eleanor's chest every time she noticed it. "Morning sunshine," she called, her voice stronger than she felt. "Cereal's ready for you." "Aren't you eating, Grandma?" Tyler asked, sliding into his chair. His eyes, so like her daughter's, watched her with a child's perceptiveness that missed nothing. Eleanor busied herself with wiping down the already clean counter. "Had my toast earlier, dear. You know how I like to eat with the birds." The lie came easier now. After months of practice, she watched as he lifted the spoon to his mouth, each bite a small victory. When he wasn't looking, she slipped his untouched apple into her pocket. Lunch, if the gnawing in her stomach became too much to bear. After Tyler left for school, the bus driver keeping a special eye on him at Eleanor's request, she settled at the kitchen table with her notebook and pencil. The column of numbers told their brutal story: rent, electricity, Tyler's medications, the surgery. She'd already negotiated payment plans for everything else, had already canceled her own blood pressure prescription. Eleanor licked the pencil tip, a childhood habit that returned under stress, and made another calculation. If she skipped lunch every day, and dinner 3 times a week, they would have enough by the surgery date. Almost enough. The afternoon sun slanted through dusty blinds as Eleanor folded laundry, each movement deliberate to conserve energy. Her vision blurred occasionally, dark spots dancing before her eyes when she stood too quickly. A small price, she reminded herself. A very small price. The clothes she folded were increasingly loose on her frame, another blessing in disguise, as she could tighten her belt another notch, and no one would notice. The phone rang, its shrill tone cutting through the quiet house. "Mrs. Simmons, this is Dr. Patterson's office." The receptionist's voice was professionally pleasant, but Eleanor detected the underlying tension. "I'm calling about Tyler's pre-surgical consultation tomorrow. Our records show there's still an outstanding balance that needs to be addressed before we can proceed with scheduling the operation." Eleanor's throat tightened, her practiced composure threatening to crack. "I understand," she managed, clutching the phone so tightly her knuckles whitened. "I'll have another payment tomorrow. Please, we can't delay this surgery." She heard papers shuffling on the other end, the cool, impersonal sound of someone who dealt with desperation every day. "The surgical team needs to be secured, Mrs. Simmons. Dr. Patterson has been quite clear about the timeline." The unspoken threat hung in the air. "Pay, or lose your place in line. Pay, or watch your grandson weaken day by day." After hanging up, Eleanor sat motionless, the late afternoon shadows stretching across the kitchen floor. With trembling resolve, she reached for her coat and the small lockbox hidden in the back of her closet. Inside lay her last treasures, her mother's pearl earrings and the gold locket that held a curl of Tyler's baby hair. "Forgive me," she whispered to the ghosts of her past as she slipped these final heirlooms into her pocket. The pawn shop owner barely looked at her as he assessed the jewelry, his practiced eyes calculating value against desperation. Eleanor took the offered money without haggling, the bills clutched in her hand, feeling simultaneously like everything and nothing. Outside, the early evening air bit through her thin coat as she headed toward the bus stop. The hospital loomed in the distance, its windows glowing with sterile promise as darkness fell. Eleanor's legs trembled as she climbed the hospital steps, exhaustion and hunger making her movements uncertain. The bright fluorescent lights of the reception area made her blink rapidly, momentarily disoriented. She clutched her purse with both hands, feeling the weight of the money inside. Not enough, never enough, but all she had. As she approached the billing department window, a young doctor rushed past, his white coat flapping, the brief current of air carrying the scent of antiseptic and coffee. He glanced at her, then paused mid-stride, his brow furrowing as he watched her steady herself against the wall. "Ma'am? Are you all right?" The doctor's voice cut through Eleanor's concentration as she carefully counted bills at the payment window. She startled, several worn 20s slipping from her trembling fingers to flutter to the floor. The young doctor stooped to retrieve them before she could bend down, a movement that would have surely sent her reeling from lightheadedness. "Here you go," he said, noticing how his hand nearly engulfed hers as he returned the money. Her skin felt papery cool to the touch. Eleanor mumbled her thanks, turning back to the receptionist who watched the exchange with practiced indifference. "This is for Tyler Simmons," she explained, pushing forward the stack of bills she'd just counted, "for his heart surgery next week." The receptionist took the money, typed something into her computer, then frowned at the screen. "Mrs. Simmons, this payment still leaves a significant balance." The woman's voice lowered, a small mercy in the busy corridor. "I'm afraid Dr. Patterson's office will need the full amount confirmed before they can proceed with scheduling the OR. Eleanor's shoulders sagged visibly, the last of her carefully maintained composure beginning to crumble. "What else can I possibly sell?" The thought screamed through her mind as she nodded woodenly, accepting the receipt. There was nothing left. No furniture worth anything, no jewelry, not even her wedding band. She had already approached every charity, applied for every program. The wall she'd been running toward for months now stood directly before her, unyielding. The doctor, who had lingered nearby, studied the elderly woman's face with growing concern. Dr. James Chen, according to his badge, stepped closer. "Excuse me," he said to the receptionist, "which patient file is this?" Before she could object to the breach of privacy, he added, "I'm covering for Dr. Patterson this week." A small lie, but one that gained him access to the screen. She reluctantly turned toward him. Eleanor stood frozen, unsure whether to leave or stay, as the young doctor quickly scanned the information. His eyes widened slightly at what he read, then darted to Eleanor's thin frame, taking in details his medical training had taught him to notice: the slight tremor in her hands, the dull sheen of her hair, the way her clothes hung loosely on her diminished frame. "Mrs. Simmons, could I speak with you privately for a moment?" he asked, his voice gentle but leaving no room for refusal. They sat in a small consultation room, its beige walls and outdated motivational posters failing to soften the institutional atmosphere. Dr. Chen reviewed Tyler's file on his tablet, his expression serious. "You're raising your grandson alone?" he asked, though the answer was already there in the paperwork. Eleanor nodded, her hands clasped tightly in her lap to hide their shaking. "And you've been making these payments yourself?" "He's all I have," she answered simply, as if those 5 words explained everything. The empty refrigerator, the pawned treasures, the hunger that had become her constant companion. Perhaps they did. Dr. Chen's gaze softened as he looked at her, really looked at her, seeing beyond the patient chart to the woman who was sacrificing herself piece by piece. "Mrs. Simmons, when was the last time you ate?" The question was professional, clinical, but delivered with a gentleness that nearly undid her. Eleanor opened her mouth to offer her practiced lie, then closed it again. The room felt suddenly too bright, too warm. "Yesterday morning," she admitted, her voice barely above a whisper. "The food stamps come next week." She didn't add that most of those would go to Tyler's special diet, the low-sodium foods that cost nearly twice as much as regular groceries. She didn't need to. The doctor's expression told her he had already done that calculation. Dr. Chen sat forward, setting the tablet aside. "Tyler's condition is ventricular septal defect. It's quite severe." His words were measured, careful. "But it's a procedure I've performed many times." Eleanor's brow furrowed in confusion. Dr. Patterson was supposed to be Tyler's surgeon. Before she could ask, Dr. Chen continued, "I'm actually the attending cardiac surgeon on Dr. Patterson's team, and I'd like to take Tyler's case personally." Eleanor's hands tightened around her purse. "Doctor, I appreciate that, but I can't afford." He raised his hand, stopping her mid-sentence. "Mrs. Simmons, I'm volunteering to perform this surgery." The words hung in the air between them. Impossible, unbelievable, no fee. Eleanor stared at him, waiting for the catch, the hidden clause, the cruel joke to reveal itself. None came. Instead, the young doctor slid a tissue box closer to her as tears began to spill down her weathered cheeks. "Why?" The question escaped before she could contain it. "Why would you do this?" Dr. Chen's expression shifted, something personal briefly eclipsing the professional facade. "Because someone did the same for my sister when we were children," he answered quietly. "My parents were immigrants. We had nothing. A surgeon saw that and stepped forward." He smiled then, the first real smile she'd seen in this sterile place of forms and payments and cold efficiency. Sometimes medicine remembers what it's supposed to be. Eleanor's vision blurred completely then, her thin shoulders shaking with sobs she'd held back for months. Dr. Chen waited patiently, neither rushing her nor offering empty platitudes. When she could finally speak again, her voice was raw. "Thank you doesn't seem enough." "It's more than enough," he replied, standing and offering her his hand. "Now we need to get some nutrition into you. Tyler needs his grandmother healthy for his recovery." He spoke with such simple certainty about Tyler's future, not if he recovered but when, that Eleanor felt something long dormant unfurl in her chest. Hope. As they walked toward the hospital cafeteria, Dr. Chen explained what would happen next. The surgery would be scheduled for Monday morning. There would still be hospital fees, but he would help her apply for emergency assistance programs that could cover most of them. As he spoke, Eleanor found herself listening to the timbre of his voice rather than the words themselves, the steady confidence of it wrapping around her like a blanket. In the cafeteria, Dr. Chen filled a tray with simple, nutritious foods and placed it before her. "Eat slowly," he advised, pouring her a glass of milk. "Your body needs to readjust." Eleanor looked down at the first real meal she'd seen in months, then back up at this stranger who had just changed everything with a few words and a signature on a form. She picked up her fork with shaking fingers as the doctor checked his pager and stood to leave. "I'll see you Monday morning, Mrs. Simmons," he said, his hand briefly touching her shoulder. "We'll take good care of Tyler." He turned to go, then paused, looking back at her with quiet intensity. "And in the meantime, promise me you'll eat every meal. Both of you need strength for what's ahead." Eleanor nodded wordlessly, watching as he disappeared through the cafeteria doors, back into the hustle of the hospital corridors, where life and death decisions were made, every hour of every day. Monday morning arrived with a sky still dark, stars fading as Eleanor helped Tyler dress in the pre-dawn quiet. "Will it hurt, Grandma?" he asked, his small voice steady despite the fear visible in his eyes. Eleanor's hands stilled on his shoelaces, her heart contracting painfully at the bravery in his young face. She wanted to lie, to offer soothing platitudes, but something in his expression demanded truth. Afterwards, yes, a little, she admitted, smoothing his hair back from his forehead. But you'll be asleep during the operation, and they have special medicine to help with the pain when you wake up. Tyler nodded solemnly, processing this information with the peculiar gravity of children who have spent too much time in hospitals. Eleanor marveled at his courage, so much greater than her own, as she fought to keep her hands from shaking. The hospital corridors seemed endless as they followed a nurse toward the pre-operative area. Eleanor's arm wrapped protectively around Tyler's thin shoulders, feeling each of his labored breaths. The harsh fluorescent lighting cast everyone in a sickly pallor, making it impossible to distinguish the truly ill from the merely anxious. Tyler clutched his small backpack containing the stuffed dragon he'd had since infancy, a talisman too precious to leave behind on this most important day. "Good morning, Tyler." Dr. Chen's voice came from behind them, warm and confident, in the sterile hallway. He wore dark blue scrubs, a surgical cap already covering his hair. Eleanor felt Tyler's shoulders relax slightly beneath her arm. The doctor had visited them twice over the weekend, establishing a rapport with the boy that now paid dividends in trust. "Are you ready for your special heart tune-up today?" The pre-operative room buzzed with quiet efficiency as nurses checked Tyler's vital signs, placed an IV line, and explained each step with gentle clarity. Eleanor sat beside the bed, her hand never leaving her grandson's, her eyes tracking every movement of the medical team. Dr. Chen reviewed the procedure once more, using simple drawings to show Tyler exactly what would be fixed. "See this hole between these two chambers? We're going to close it so your heart can work properly." A nurse approached with a small cup containing pre-surgical medication. "This will make him a little drowsy," she explained to Eleanor. "It helps children feel calm before they go to the operating room." Tyler looked at the pill dubiously, then at his grandmother for reassurance. Eleanor nodded encouragingly, though her own heart raced with fear she dared not show. "When you wake up, I'll be right here," she promised, pressing her lips to his forehead. "Please let that be true," she prayed silently. "Please let him wake up." She had read enough about the procedure to know its risks, the potential for bleeding, infection, heart rhythm abnormalities. Each possibility had haunted her nights for weeks, spectral threats she could neither fight nor flee. The medication took effect quickly, Tyler's eyelids growing heavy as he clutched his dragon closer. "Love you, Grandma," he murmured, the words slightly slurred. Before Eleanor could respond, the transport team arrived to take him to the operating room. The moment of separation, the one she had dreaded most, arrived with brutal swiftness. Dr. Chen touched her arm gently, his eyes meeting hers. "I'll take care of him as if he were my own," he promised quietly. "The operating room has a phone. I'll have my nurse call out with updates." Eleanor nodded, unable to speak past the knot in her throat. She bent to kiss Tyler one last time, inhaling the scent of his hair, committing to memory the feel of his soft cheek against hers. Then they were wheeling him away, the bed disappearing through double doors that swung shut with terrible finality. The surgical waiting room existed in a different dimension, one where time stretched and compressed without logic or mercy. Eleanor sat rigidly in a chair designed for someone else's comfort, her hands twisting the strap of her purse until the vinyl coating began to crack. Around her, other families waited for their own verdicts, some chatting nervously, others staring silently at phones or magazines without seeing them. A volunteer offered her coffee, which she accepted but didn't drink, the styrofoam cup growing cold in her hands. 2 hours passed according to the wall clock, though it felt simultaneously like minutes and days. The promised phone calls came. "They've begun the procedure. Everything is proceeding as expected." His vital signs remained stable, each one allowing Eleanor to exhale briefly before tension reclaimed her body. She tried to pray but found herself unable to form coherent thoughts, her pleas reduced to his name repeated like a mantra. "Tyler, Tyler, Tyler." At the 3-hour mark, the update stopped. Eleanor stared at the phone on the volunteer's desk, willing it to ring. When 15 minutes passed with no word, she approached the desk, her legs wooden beneath her. "My grandson, Tyler Simmons, he's in surgery with Dr. Chen. We haven't had an update." The volunteer smiled reassuringly, but Eleanor saw the flicker of concern before it was masked. "Let me check for you," the woman offered, picking up the phone. Eleanor watched her face during the brief conversation, trying to decode the professional neutrality. "They say Dr. Chen is still in the procedure. Everything is progressing." The carefully chosen words, "not going well but progressing," sent ice through Eleanor's veins. She returned to her seat, the waiting room suddenly too bright, too loud with the mundane sounds of magazines being flipped and coffee being sipped. 4 hours and 27 minutes after Tyler had disappeared through those double doors, the phone rang again. Eleanor's head snapped up, her entire being focused on the volunteer's face as she listened. "Yes, she's here. I'll tell her." The woman hung up and looked directly at Eleanor. "Dr. Chen would like to speak with you. They'll be bringing him to the consultation room shortly." No, no, no. Eleanor's mind rejected the scenario immediately. Good news came via phone updates. Face-to-face meetings meant complications, meant decisions to be made, meant the worst. She felt herself standing, following the volunteer down a hallway that stretched like a nightmare, each step taking her closer to words she could not bear to hear. The consultation room was small, windowless, equipped with tissues and privacy, a room designed for devastating conversations. Eleanor lowered herself into a chair, her legs no longer capable of supporting her. When the door opened minutes later, she looked up with eyes already brimming, prepared to beg if necessary, for more time, for more interventions, for miracles she no longer believed in but desperately needed. Dr. Chen entered still wearing his surgical cap, his mask hanging loose around his neck. His face showed exhaustion, the lines around his eyes deeper than they had been that morning. Eleanor couldn't breathe, couldn't speak, could only wait for the blow to fall. The surgeon pulled a chair close to hers, his movements deliberate, careful. He took a deep breath and met her eyes directly. "There were complications," he began, and Eleanor felt the room tilt around her. A high-pitched ringing filled her ears as Dr. Chen continued speaking, his words reaching her as if through water. "The defect was larger than the imaging showed. We had to place him on bypass longer than anticipated." He leaned forward, his gaze never leaving hers. "But we completed the repair, Mrs. Simmons. It was challenging, but successful." The words didn't register immediately, their meaning obscured by the terror that had preceded them. "Tyler is," she whispered, unable to finish the question. "Tyler is in recovery," Dr. Chen said, his exhausted face finally breaking into a smile. "His heart is beating strongly on its own. The repair is holding beautifully." He reached out, his hand covering her clenched fist. "He's going to be okay, Mrs. Simmons. Really okay. Not just surviving, but living a normal life." A sound escaped Eleanor then, something between a sob and a laugh, her body folding forward as if the strings holding her upright had been cut all at once. "Dr. Chen's hand remained steady on hers as she wept, not the careful, controlled tears she had permitted herself during these months of struggle, but raw, primal sobs that shook her entire frame. They were tears of relief, of gratitude, of disbelief that the long nightmare might finally be ending. "When can I see him?" she asked when she could speak again, straightening up and wiping her eyes with the tissue Dr. Chen offered. The surgeon checked his watch, making a quick calculation. "He'll be in the ICU for monitoring tonight. He's still intubated and sedated, but they should be ready for you to visit in about 30 minutes. He stood, stretching subtly to ease muscles cramped from hours of focused surgery. "I'll take you there myself once they call." As promised, Dr. Chen accompanied Eleanor to the pediatric ICU when the call came. They walked in silence, the doctor matching his pace to her slower steps. At the unit's entrance, he paused, his hand on the door. "He's connected to many machines right now," he warned gently. "It looks frightening, but each one is helping him recover. Try to focus on his face, not the equipment." The doors swung open, and Eleanor's world narrowed to a single bed surrounded by beeping monitors, blinking lights, and hanging IV bags. In the center of this technological cocoon lay Tyler, impossibly small and still. A breathing tube obscured part of his face, but Eleanor saw immediately what mattered most, the healthy pink color that had replaced the bluish tinge of his lips. She moved to his bedside as if in a trance, her hand hovering over his before gently, carefully taking his fingers in hers. At her touch, Tyler's eyelids fluttered, the faintest movement almost imperceptible but unmistakable to a grandmother's watchful eye. The monitor above the bed registered a slight increase in heart rate, its steady beeping a percussive counterpoint to Eleanor's whispered words of love and encouragement. Dr. Chen stood at the foot of the bed, observing the vital signs with professional satisfaction and something more, a quiet acknowledgement of the moment's sacred weight. His body recognizes you're here, he said softly, nodding toward the monitors. Even through the sedation he knows. Eleanor didn't look up, couldn't look away from Tyler's face, but she nodded in acknowledgement. Her fingers gently stroked her grandson's hand, careful to avoid disturbing the IV line secured there. As she settled into the chair beside Tyler's bed, a chair she would barely leave for the next 24 hours, Eleanor felt something unfamiliar bloom in her chest. Not just relief or gratitude, but something that had been absent for so long she'd almost forgotten its shape. It took her a moment to recognize it, this strange, luminous feeling expanding beneath her ribs. It was hope. Dawn broke through the ICU windows, painting Tyler's room in soft golden light. Eleanor, who had dozed fitfully in the chair beside his bed, stirred at the change in brightness. The night nurse had dimmed the overhead fluorescence hours ago, allowing both patient and grandmother to rest in relative darkness, interrupted only by the rhythmic glow of monitoring equipment. Now, as morning arrived, Eleanor blinked and focused immediately on Tyler's face. Overnight, the medical team had removed his breathing tube, replacing it with a simple oxygen cannula. Without the apparatus obscuring his features, Eleanor could see her grandson fully, the gentle rise and fall of his chest, the peaceful expression that had replaced yesterday's drugged unconsciousness. His coloring had improved dramatically. The healthy pink of his cheeks made tears spring to Eleanor's eyes. She had forgotten what he looked like, without that subtle blue tinge, that constant visible reminder of his damaged heart. "Good morning, Mrs. Simmons." Dr. Chen entered quietly, fresh scrubs replacing yesterday's surgical attire. He moved to Tyler's bedside with practiced efficiency, checking the monitors, then gently examining the surgical dressing visible at the top of the boy's hospital gown. "His vitals are excellent. The night team reported no arrhythmias, and his oxygen saturation is better than we typically see this soon after surgery." Eleanor nodded, struggling to translate the medical terminology into what mattered most. "So he's healing well?" she asked, her voice rough from the night's vigil. Dr. Chen's smile provided the answer before his words could. "Better than well," he confirmed. "The repair is holding perfectly. His heart is working the way it should have from birth." He made a note in the electronic chart, then lowered his voice. "We'll move him to the regular pediatric floor later today if this progress continues. The ICU team needs the bed, and Tyler is stable enough to step down." As if sensing he was the subject of conversation, Tyler's eyelids fluttered, then opened fully. For a moment, confusion clouded his gaze as he took in the unfamiliar surroundings, the beeping machines, the IV pole, the strange room. Then his eyes found Eleanor, and clarity returned. "Grandma." His voice was barely a whisper, hoarse from the breathing tube. "I'm right here, sweetheart." Eleanor leaned forward, her hand gently stroking his hair. "Everything went perfectly. Dr. Chen fixed your heart." Tyler's eyes shifted to the surgeon, who moved closer to the bed. "How do you feel, buddy?" Dr. Chen asked, his professional demeanor softening as he addressed his young patient. Tyler considered the question with serious deliberation. "Thirsty," he finally decided, "and my chest hurts." He reached tentatively toward the bandaged area, but Eleanor gently intercepted his hand. "We can help with both of those things," Dr. Chen assured him. "The nurse will bring some ice chips for your throat, and will adjust your pain medicine." He demonstrated the patient-controlled pain button, showing Tyler how to press it when the discomfort increased. "Your body is working very hard to heal, so it's important to rest and tell us when something doesn't feel right." Throughout the morning, Tyler drifted in and out of sleep, each awakening bringing more alertness, more of his personality emerging from the fog of anesthesia and pain medication. Eleanor maintained her position beside the bed, leaving only briefly when the nurses needed to change dressings or perform assessments. During one such moment, standing in the hallway outside Tyler's room, she found herself face to face with Dr. Chen again. "You should get some rest yourself," he advised, noting the dark circles beneath her eyes. "Tyler is stable, he'll be monitored constantly." Eleanor shook her head, the mere suggestion of leaving unthinkable. "I promised I'd be here when he woke up," she reminded him. Every time he wakes up, the surgeon studied her face, recognizing the immovable determination there. Instead of arguing, he gestured toward the family waiting area. "At least let me buy you a decent cup of coffee then. The cafeteria makes a better brew than those waiting room urns." When Eleanor hesitated, he added, "We'll tell the nurses where to find you if Tyler needs anything. 5 minutes, that's all." In the cafeteria, Dr. Chen returned to their table with 2 steaming cups and a plate of toast. "You need to eat," he said simply, pushing the food toward her. Eleanor realized suddenly that she was hungry, genuinely hungry, not just empty. The perpetual knot of anxiety that had suppressed her appetite for months had loosened its grip. She took a piece of toast gratefully. "I don't know how to thank you," she said after several moments of silence. "Not just for the surgery, but for," she gestured vaguely, words failing to encompass everything she meant: the volunteered time, the saved money, the compassion, the future suddenly unfolding before them. "I told you why I did it," Dr. Chen replied, his eyes warm. "But there is one thing you can do for me." Eleanor looked up expectantly. "Take care of yourself as well as you take care of him. Tyler needs you healthy and strong for the life he can now have." He hesitated, then added more softly, "And you deserve to live that life alongside him." By afternoon, as promised, Tyler was transferred to the regular pediatric ward. The room felt luxurious after the cramped ICU space, windows that actually opened, a reclining chair for Eleanor that converted to a sleeper, even a small television mounted on the wall. Tyler, more alert now, examined his new surroundings with interest. "Look, Grandma, they have video games," he exclaimed, pointing to the console attached to the TV. "For when you're feeling stronger," Eleanor agreed, adjusting his blankets as he shifted position. The simple movement made him wince, his hand going instinctively to his chest. "Careful, sweetheart. Remember what Dr. Chen said about moving slowly." "It hurts less than before," Tyler offered, attempting to reassure her. "And look," he held up his hand, turning it back and forth in the sunlight streaming through the window. "My fingers aren't blue anymore." The simple observation, delivered with a child's matter-of-fact acceptance, nearly undid Eleanor completely. She had become so accustomed to that bluish tinge that she'd almost stopped seeing it. Now its absence proclaimed the miracle they'd been given. The days that followed fell into a gentle rhythm. Each morning brought new progress. Tyler sitting up, Tyler taking his first tentative steps to the bathroom, Tyler completing a full lap of the pediatric floor with a nurse's assistance. Eleanor watched it all with wonder, her own strength returning as she finally began eating regular meals, many of them brought by hospital staff who had heard about her situation and quietly added extra trays to Tyler's room. On the 5th day after surgery, Dr. Chen arrived for his morning rounds, carrying something tucked under his arm. "I brought a visitor," he announced, presenting Tyler with a stuffed dragon, nearly identical to his beloved one, except this dragon wore tiny surgical scrubs and a miniature stethoscope. "I thought your dragon might want a friend who understands medical stuff." Tyler's face lit up as he accepted the gift, immediately introducing the new dragon to his original one. Dr. Chen turned to Eleanor while Tyler was distracted. "His latest echocardiogram looks perfect," he said quietly. "If everything continues this way, he can go home in 2 days." Home, home. The word resonated through Eleanor's chest like a bell. Home, where Tyler would sleep in his own bed, breathe without monitoring, live without the constant shadow of his defective heart. Home, where Eleanor would no longer need to count pennies for surgery, no longer need to skip meals to save for medical bills. The future stretched before them, suddenly vast with possibility. On the morning of discharge, Eleanor packed Tyler's few belongings while he sat on the edge of the bed, swinging his legs experimentally. He tired easily still, but his energy increased visibly each day. "Will my scar look cool?" he asked, peering down at the bandage that would soon be replaced with a smaller dressing. "Like a superhero?" "The coolest," Eleanor assured him, zipping his backpack closed. A mark of bravery. She didn't add that it would fade with time, becoming a thin white line down his sternum, visible proof of the day his life truly began. Some truths were for later, when he was old enough to understand the full measure of what had happened here. Dr. Chen arrived with the discharge papers and final instructions. "No rough play for 6 weeks," he reminded Tyler seriously. "Your job is to rest and get stronger. Mrs. Simmons will help you remember when to take your medicine." He demonstrated once more how to care for the healing incision, then handed Eleanor a card with his direct number. "Call any time with questions, day or night." As they prepared to leave, a hospital administrator appeared in the doorway. Eleanor tensed automatically, conditioned by months of difficult financial conversations, but the woman smiled warmly. "Mrs. Simmons, I wanted to let you know that the hospital's charity care program has approved coverage for all of Tyler's inpatient expenses." She handed over a folder. "This explains everything, but the simple version is there's no bill." Eleanor stared at the folder in her hands, unable to process the words. No bill, no debt, no more impossible choices between food and medicine. Dr. Chen watched her face, his expression gentle. "The administrator is also a grandmother," he explained simply. When Eleanor finally looked up, tears streaming unchecked down her cheeks, he added, "Some battles you shouldn't have to fight alone." The journey through the hospital corridors felt entirely different from their arrival. Not a march toward uncertainty, but a procession of triumph. Nurses stopped to high-five Tyler, orderlies called out good wishes, even patients in the waiting area seemed to sense the victory in their passing. At the hospital entrance, Dr. Chen helped them into the taxi he'd arranged, refusing Eleanor's stammered thanks, with a smile and a simple request: "Send me a photo when he starts school in the fall." Back home, the small apartment felt transformed, not by any physical change, but by the lifting of the shadow that had hung over it for so long. Tyler moved carefully to his bedroom, eager to see his toys, his books, his own familiar space. Eleanor followed, watching as he settled onto his bed with a contented sigh. "It feels different," he observed, looking around the room. "What does, sweetheart?" Eleanor asked, sitting beside him on the bed's edge. Tyler considered the question seriously, his face scrunched in concentration. "Everything," he finally decided. "Like the air is easier." He placed a hand over his chest, feeling the steady, strong beat beneath the bandage. "Like my heart isn't working so hard anymore." Eleanor nodded, understanding completely. "That's exactly right," she agreed, her own heart full to bursting with gratitude and wonder. "Everything is easier now." Tyler yawned suddenly, the excitement of homecoming taxing his still recovering body. Eleanor helped him lie back against his pillows, pulling the familiar rocket ship comforter up to his chin. "Will you stay until I fall asleep?" he asked, his eyes already drooping. Eleanor settled more comfortably on the edge of the bed, her hand finding his beneath the blanket. His fingers, pink and warm, no trace of blue, curled trustingly around hers. "I'll stay as long as you need," she promised, watching as sleep claimed him. In the quiet of the afternoon, sunlight streaming through the bedroom window, Eleanor felt the full weight of the miracle they'd been given, not just a repaired heart, but a future. Tyler's fingers tightened briefly around hers as he drifted deeper into sleep, and in that simple gesture lay everything. All the fear they'd survived, all the hunger she'd endured, all the hope that now stretched before them like an open road.